Hello, my name is Dr. Joseph Daniel. I'm a board-certified plastic surgeon in Greenville, Delaware. We are just minutes from downtown Wilmington. And today we're going to talk about rhinoplasty. Rhinoplasty, otherwise known as a nose job, is one of the most common cosmetic procedures in the country. And um, there are obviously many different types of noses, many different types of rhinoplasty, and we're going to try to simplify it for you today. It's important to make a distinction between the outer cosmetic appearance of the nose and the internal workings of the nose. So for instance, deviated septums, poor breathing, snoring, issues with the airway, they are sort of considered, they're oftentimes combined with rhinoplasties, but it's really a separate issue, and that type of problem is typically paid for by insurance since it's a functional airway problem. It does oftentimes make sense to combine the functional airway issue if it's present with a cosmetic rhinoplasty. Because obviously you're dealing with one structure in one area. So the cosmetic goals of a rhinoplasty are basically to individualize it to you. So the idea is not to create a cookie cutter nose that is the same appearance for everybody. The goal is to create a nose that matches your face, and if the goal is, if, for instance, you have a large nose, that's fine, but you want to have a large attractive nose, or a large nose that fits your face. Or if you have a small face and smallest features, then a smaller nose fits your face, and that is a bit of the goal. So the goal should not just be to constantly be making the nose smaller, 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 and producing the surgical look. Producing a surgical look is a really preventable and really not necessary. So there are two types of surgical techniques. There's the open and the closed technique. I prefer the open rhinoplasty technique for most patients because I think it gives the most amount of precision, visualization of everything, and you have the most control. The open technique requires a small incision just at the base of the nose here, and that small incision is just a few millimeters long and makes all the difference in my hands in creating a pleasing nose using meticulous technique. So, for instance, taking down a prominent hump, or basically straightening a profile, is a common procedure. Narrowing the bony width, creating more definition at the tip, narrowing the nostrils. These are all standard rhinoplasty techniques. Rhinoplasty is usually done at the hospital or surgery center, practically always outpatient. There is some downtime. Usually a splint is required, occasionally some bruising, particularly if the bones need to be repositioned. I don't tend to use packing, but occasionally that's necessary. And in about 5 days or so, basically all packing or splints or whatnot are removed, and you generally look fairly attractive, assuming you don't have too much bruising. If you do have a bruise, it's typically gone by 2 weeks, and the final result is anywhere from 6 to 12 months, with most people being just about there in about 2 or 3 months. Pain is surprisingly little, and it's a very, very quick recovery. So we do have computer imaging, and what we do with that is take a picture, and then on the computer screen we morph the projected post-op result, and that allows us to discuss various maneuvers and make sure that we're communicating with each other as to what the goals are.